Hello there. Welcome to the walk-in clinic. I'm sorry you've had to wait. We're extremely busy today. Are you comfortable there? Good. Just bear with me a second and I'll just check the notes that my nurse has prepared, okay? Let's just see. Okay. Can you just confirm your name for me? Oh, I can tell you're having problems speaking. Okay. I'll try not to ask too many questions. And you can always nod for yes and no. Alright, okay. And just your date of birth for me. Great, thank you. Alright. Okay, let's just see what the nurse has put down. Okay. So you're experiencing very severe sore throat? Yeah, it's okay. You can just nod for yes, shake for no. Okay. Have you been feeling shivery, feverish? You have? Okay. And how long has this been going on for? Okay. It's got worse over the past 3 days. Okay. Okay. Any headache? Yeah. Okay. Ear pain? Okay. And you've been feeling nauseous too? Alright. Any abdominal pain? A little, okay. And have you noticed any rashes on your body anywhere? No, okay. Have you had this before, do you think? No, okay. Are you prone to sore throats? No, okay. And have you been close to anybody with a similar infection? Okay. So, your partner has had a very sore throat too, but hasn't felt as unwell as you. Okay. Right. Well, we mustn't just assume that it's a viral infection or a simple cold, because you do look quite poorly, so I'm going to have to give you a nice examination to make sure we find out exactly what's going on with you. Is that okay? Good, good. Okay, well, first things first, I'm going to get some gloves on. Are you okay with latex? I am going to just pop an apron over me. There we go. This is as much for my protection as it is for yours too. Okay. I'll just tie that up a little bit. All right. Okay. So first thing, I'd like to take your blood pressure, just to check that first, if that's okay. Have you been feeling dizzy? A little, okay. All right. So you've had your blood pressure taken before, I'm sure? Yeah, So I will put a cuff around your arm, and that cuff will inflate. It will feel tight for a while, but it shouldn't be painful. Okay? If it is too uncomfortable for you, please let me know. All right? Okay. I'll do your right arm first. If you can just outstretch this right arm for me. Okay. There we go. Let's pop that cuff on. There we go. And I'm going to inflate the cuff. Just need to pop the stethoscope into the crease of your elbow, just above there. Okay. All right. I'm just going to inflate the cuff now. You should hear it inflating and feel it tight on your arm. Yeah. Good. Okay, that's pretty good. Let's take that off. Okay, I would like to try it on your left side if that's okay with you. Okay, just pop your left arm out for me. Great, I'll just put the cuff on. There we go. And pop the stethoscope onto your arm and inflate the cuff. Okay, that's fine. I'm happy with that. Let's just remove the cuff. There we go. Okay, now while I've got my stethoscope in my ears, I'd like to just have a little listen to your chest. Okay, to see if there's anything that's sounding a bit wheezy in your lungs. All right. Okay, so the stethoscope isn't too cold. That's nice. So I'm just going to place this gently onto your chest. Okay, and I'd like you to take a breath in for me and out, and again, in and out. Okay, and again, in and out, and again, in and out. Okay, can you just now breathe normally for me? Okay, and can you give me just a little cough as best you can? Okay, I'm just going to pop round the back to have a little listen round there. Okay. All right, now can you breathe in for me? And out. And in. And out. Lovely. And this side. In. And out. And in. And out. Okay. That's great. Thank you. Okay, so for the next part of the examination, I'd just like to check your lymph nodes. Okay, have you noticed that anything may have been swollen around your throat area and your neck? It does feel a little sore. Okay, all right. So I'm going to be checking behind your ears, okay, front of your ears, down your neck, at the back of your head, and just across your shoulder blade area there. Okay? All right. So let's just go behind the occipital area, okay, behind your ears. Okay, underneath your jaw and down your neck there. Okay, does that feel okay for you? Good. Okay, and just across that area there. Okay. Are you okay with me checking the lymph nodes underneath your arm? Okay. Let me just roll that back a little bit there. Okay. Alright, just lift your arm above your head for me. That's great. Okay, I've just got to press in the several different areas of the armpit. I've got several different lymph nodes there that can swell. Alright, okay, that's fine. And on this side, just lift your arm for me. There we go, I'll support it. Alright. Okay, let's do the anterior and posterior there. Okay, and let's push right in there underneath. I'm sorry, this might be a little bit uncomfortable. Push in there. Okay, and rest your arm. There you go. Okay, so you do have some swelling of the lymph nodes in the neck area. Okay, but that is usually just an indication of some infection. Okay, I'm not particularly worried about that at this point, okay, because they feel quite spongy. Okay, they're not too hard. Alright. Okay, let me just make a couple of notes. Okay. Okay. Your blood pressure was 130/84. So I was happy with that, okay. I think you're a little bit anxious and also you're unwell, so that's okay. Alright. Okay. So for the next part of this, I'm going to have a little look into your throat, if that's okay. Now I know this is probably going to feel rather uncomfortable for you, and I don't want to make it any more uncomfortable than it has to be, because I suspect you've got quite a nasty looking throat in there at the moment. Alright, okay, so I've got a tongue depressor. I'm not wanting to use this too much because when you can't swallow so well, I don't want to make you gag. Okay, so I'm going to use this little light, okay, and I'd like you to open your mouth for me, and I'll pop this on your tongue, and if you can just quickly say "ah" for me. Okay, so there we go. I'm shining the light in. Can you say "ah" for me? Okay, and again. Okay, and can you just open a tiny bit wider? Okay, right. Can you just keep your mouth open for me? I'm not using the tongue depressor anymore. Okay, I just want to have a little look around your mouth. Okay. Alright. Okay. You have a very, very inflamed throat, okay? Your tonsils are covered in white spots. They're swollen. I think what we are looking at here is strep throat, but I'm going to take your temperature next. Okay, and I'll just jot down the findings there. Okay, and I'll just take your temperature. Okay, so I'm just going to pop this under your tongue. Okay, it's very, very quick. All right, there we go. Okay. All right. We need to get your temperature down. We really do. Have you taken any paracetamol? Okay, you can't swallow it right now. I'm pretty sure you can't by the look of your throat there. Okay. All right. So, what I'm going to do first is I'm going to give you, if you're okay with this, an injection of paracetamol. Yeah? Okay. Because that will get to work quite soon. I'm concerned you can't swallow the medication. Okay, so let me just give your arm a wipe. Okay, you okay with me doing it in your right arm? Yeah. Okay. All right. Just bear with me while I prepare the syringe. Okay. There we go. Okay. It's coming in with that now. Right. Okay. All done. Okay. You did great. So I'll just put a drop that I've administered that for you. So I am paracetamol. Okay. Now I want to take a look in your ears. Okay, so I'll just be pulling the ear up and back and inserting the otoscope into the ear just to have a look around. Okay, this may feel quite tender for you because you have got some infection going on there. So tell me to stop if it's too uncomfortable for you. I'll be as gentle as possible, but I do just need to have a look to see if the infection is affecting the ear. Okay? All right. So, got the light on and I'm just going to pull the ear up and back. Okay, there we go. And insert the otoscope, and I'm just visualising the ear canal. It does look slightly red, and at the bottom I can see that your eardrum does have a little bit of fluid behind it, so that would indicate that there is some infection there. It does look a little bit angry. Okay, I don't want to spend too much time doing this because it will be a bit sore for you, so I'll just remove the otoscope. Are you okay there? Okay, I'll just come round to this side and have a little look here, that's okay. Okay, and I'll be very gentle and I'll be as quick as possible. Okay, so just pulling the ear up and back to straighten the ear canal and inserting the otoscope there. Okay. Just looking around. Again, a little bit of redness, and I can see some fluid behind the eardrum, which I kind of would expect to see in this kind of infection. Alright, you're doing great. I'm sorry if this is uncomfortable. Okay, just withdrawing the otoscope now. Okay, well done. Alright. How are you holding up there? Okay. Okay. Now, I think what I'd like to do, if it's okay, is to take some blood from you. Yeah, that will give me a bigger picture on how things are all reacting to this infection in your blood, okay? And also give me a full screen as well, so it'll be looking at other things, you know, how is your general red blood count, and I can check for a few other things as well, like liver, kidney function as well. I'll also do a check for infectious mononucleosis, okay, which you may know as glandular fever, just in case. It may well not be that, but, you know, we have to check it, because that's a different thing from strep throat, but it does look like a strep throat to me, but sometimes it can be tricky to tell. And you have got a rather high fever, so I am quite concerned about that. Hopefully that injection will help bring that down, and we'll get you a prescription for some liquid paracetamol and liquid antibiotics, I think, at the end of this, because I don't think you're going to be able to be swallowing tablets, are you? No. Okay, so are you okay with having blood tests? Great. Okay, just bear with me, I'm going to just prep up for that. Okay. There we go. I don't need to take too much anyway. So let me just... Would you like me to do this side or this side? This side? Okay, that's fine. Since you've had an injection in that side, okay. We'll balance it up. Okay. There we go. Just see what size syringe I need. Okay. So, just got to pop this tourniquet around your arm. Again, this will feel quite tight, I'm afraid, but it's just so it brings the vein up so I can get the blood out of the best vein and as quickly as possible. Okay, so let's just put that round. There we go. And can you make a fist for me? Okay, great. Okay. I'm just going to gently pat the area to bring that vein up. Okay. Lovely. Okay, that syringe on there. Okay. And you're going to feel a sharp scratch. Okay, about now. Okay, sharp scratch. That's great. Okay. Are you alright there? Good, you're doing great. Okay. Okay. Just slowly withdrawing there. Alright. Perfect. So just put some pressure on there. Got some cotton wool there. Can you just hold that on for me? There we go. That's super. Just keep the pressure on that area, and I'll get a little dressing. And I'll pop it over for you. Okay, so let's have a look at this. Oh, that's grand. Not bleeding, that's good. Ah, well, thank you, but I've done this many times, so I should be quite good at doing it without hurting. It shouldn't really hurt anyway. Sometimes you do get some bleeding and bruising around the outside if the vein's been punctured and it bleeds quite a bit inside. And some people are more susceptible to that than others. But if you go gently, it should be fine. So I'm just going to pop this dressing over the area. Okay, there we go. All good there. Okay, so let me just put this sample into a bag. And the lab will get this done today, and I will call you with the results. Okay. So that's fine. Pop that there, and we'll get that over to the lab. Right. Okay. So you're okay with drinking at the moment, aren't you? You can drink a little bit? Yeah, that's good. Keep the fluids going in. Food, don't worry too much about that, but please keep lots of liquids going in. You might find some nice cool liquids, or sucking even on like a nice lolly might help you at the moment. Okay, so I'm going to just do a prescription for you for some liquid antibiotics, which you need to start straight away. It's quite a high dose, okay, because we need to get on top of this. If you don't feel any better within the next 48 hours, or you start to feel worse quite rapidly, I would suggest that you go to A&E. Okay, they will know that you've been here, all right, but I do want this infection under control. I think, it's quite bad at the moment, and I really don't want you to be getting even more poorly. So in with the antibiotics straight away. I'll also give you some liquid pain relief as well, okay, to help with that and to take some inflammation down. All right, okay. Let me just jot you a script. Someone has brought you here today. Yeah, okay. That's good. So the antibiotics, it's going to be 2 teaspoonfuls, 5 ml spoons, 4 times a day, okay? And that's going to be for 7 days, okay? And the pain relief medication is just 1 5 ml every 4 hours, okay? But no more than 4 in a 24-hour period, okay? So space them out as best you can. There we go. So there's your prescription, okay? You take them. I'll just remove my gloves. And I want you to go straight home, okay? Which I'm sure you are going to do. And I want you to rest, take the medication, and as I said, keep drinking. It's important that you do keep drinking. Is there anybody with you? Yeah, that's fine. Okay, your partner's there, so that's good. Want someone looking after you, because we don't want you having to do too much. You really need to rest this one out. But I say, do go to hospital if it gets a lot worse. Okay. All right then, well, I hope you feel better very, very soon. So go home and take care. All right.